Next thing that we shall be discussing is occupational diseases, and these are diseases that arise out of or in the course of an employment. We shall first of all look at some of the occupational diseases that occur due to physical agents or physical hazards, and we know that physical hazards involve heat. So excessive heat may result in heat may result in heat exhaustion, or heat stroke, or hyperpyrexia, or syncope. Prickly heat is another one of the diseases that may be a result of excessive heat in a work environment. Decreased efficiency, which is very common, and increased fatigue and accidents. These all these diseases or all these problems that are due to excessive heat, these usually occur in occupations where there are hot spots or heat stagnation in the environment. So 20 to 27 degrees Celsius is considered to be the appropriate or apt temperature for workers. Anything exceeding 27 degrees Celsius is considered to be excessive heat. Then second one is cold. Among the physical agents that can result in many of the occupational diseases, cold can result in chilblains, in erythrocyanosis, in immersion foot, in trench foot, in frostbite, and in hypothermia. So these are all the conditions that may result due to extreme cold in an occupational environment. Next among the physical agents is light, and lack of appropriate illumination in a work environment may result in eye strain, headache, or eye pain, lacrimation, corneal congestion, or eye fatigue. So these conditions also occur due to excessive light as well. So only the inappropriate amount of illumination is not the reason for these conditions. Excessive amount of light can also result in these conditions. Then there is occupational cataract and miners nystagmus, which is seen among miners who have to work in inappropriately illuminated mines where there is not enough light. This condition is seen. So annoyance, visual fatigue, and blurring are some of the less severe and more common complications of lack of light. Then another one of the physical agents that can result in many occupational diseases is noise. So noise can cause temporary or permanent hearing loss, which is then termed as occupational deafness. Then there are certain non-auditory effects of noise as well, and these are nervousness, fatigue, communication problems, annoyance, anxiety, irritability. So the noise level at any work environment is proposed to be between 85 and 90 decibels, and anything exceeding 90 dBs or decibels is considered to be a noise and a physical hazard for that occupation. Next in physical agents is the pressure. We have all heard about Caissons disease, and pressure due to explosions can result in many of the occupational diseases or incidents. Air embolism can occur in excessive pressure, especially in people who work underwater. Vibrations are another one of the physical agents that can result in occupational diseases. Vibrations are usually encountered by people who work with drills and hammers, and the excessive vibrations can give rise to a condition known as white fingers, and it can also result in injuries of joints and hands. Ultraviolet radiation, when excessive, which is usually seen in workers who work as arc welders, it may result in keratitis, which is also called welder's flash. Conjunctivitis can happen. Pain in the eye is common in places where there is excessive UV radiation. Next in physical agents is ionizing radiation, and the examples of which are places where X-rays are used or where radioactive isotopes are used. For example, in certain medical facilities, radioactive isotopes are used. So safe limit of radiation is considered to be 5 rem per year to the whole body. Anything above than that is considered unsafe. it may result in genetic changes in certain cancers, ulceration, sterility, or death. Another physical agent is electricity. It may result in electrocution or it may result in burns. Then there are chemical agents or chemical hazards among the occupational hazards, and these may be some dusts which give rise to certain diseases which are termed as pneumoconiosis because there is involvement of the lungs. And these dusts may be inorganic dusts or organic dusts. The inorganic dusts include coal, silica, asbestos, and iron. And these are the major examples of inorganic dusts, and the conditions arising due to these exposure to these chemical agents are anthracosis in case of coal, silicosis for silica, asbestosis for asbestos, and siderosis for iron. And these are all pneumoconiosis because there is involvement of lungs. Inhalation of these dusts results in pneumoconiosis. Then organic dusts include cane fiber, cotton dust, tobacco, and hay or grain dust, and these give rise to bagasosis, vicinosis, tobaccosis, and farmer's lung, respectively. Then among the chemical agents are certain gases. We talked about dusts, which are also chemical agents. Then there are gases, some gases which may result in gas poisoning, and these gases include ammonia, chlorine, nitrogen oxides, ozone, phosgene, sulfur dioxide, mercury vapor, osmium, vanadium pentoxide, and zinc chloride. All of these gases are encountered in certain uh, occupations. For example, chlorine is encountered in manufacture of alkali, bleaches, and disinfectants. Ammonia you come across in the production of fertilizers and explosives, in refrigeration, in oil refining, etc. And all these have adverse effects on the health of the worker. So these are the second type of chemical agents that result in occupational diseases. Again, we are looking at some of the diseases or some of the potential hazards that arise due to certain chemical agents that are present in certain occupational environments. Diseases may occur due to metals and their compounds, for example, toxic hazards from lead, mercury, cadmium, manganese, beryllium, arsenic, chromium may occur. Diseases due to chemicals such as acids and alkalis or pesticides may occur, and diseases due to solvents, for example, carbon sulfides or benzene or chloroform may occur. Then there are certain biological agents that may be present in the occupational environment, and these give rise to certain diseases as well, certain occupational diseases. And the examples of occupational diseases due to biological agents include brucellosis, leptospirosis, anthrax, actinomycosis, psittacosis, tetanus, hydatidosis, etc. Certain occupational cancers, for example, skin cancer, cancer of the lungs, cancer of the bladder, these cancers are associated with certain occupations as well. Then occupational dermatoses include dermatitis and eczema. In certain environments, occupational environments, uh, the workers are more likely to have dermatitis and eczema, etc. Then there are diseases of psychological origin. For example, industrial neurosis, hypertension, and peptic ulcer. These are the examples of psychological diseases which are seen in certain occupations.